Andrew Lucky P. De La Rice.
I am Jocelyn Magpago.
Mary Gunat Suson.
Jovin Trabasas.
And Kenichi V. Butan.
Case number 1. A nervous suspect with a high rate falsely appears deceptive. In a polygraph test, the subject's psychological response, such as high rate, blood pressure, respiration, and skin conductive, are measured while they are answered a series of questions. The idea is that deceptive response may cause changes in the psychological indicators because lying or being nervous can trigger stress or anxiety, which in turn may cause psychological change. However, accuracy can be compromised in certain situations, especially with a nervous suspect. Here how this happen. Nervousness and anxiety. Some individuals may naturally have elevated heart rate, increased blood pressure, or other stress response due to anxiety, regardless of whether they are lying. They can be common in high pressure situation like a polygraph test. If the suspect is nervous, their psychological response may resemble those typically seen in deceptive person even though they are telling the truth. Heart rate and deceptive. The polygraph might interpret an elevated heart rate as a sign of deceptive, but this could be just a result of a suspect being anxious or stressed about the test itself. For example, if the suspect is nervous about the process or feel pressure to perform, well, their heart rate could rise. The polygraph may be mistakenly flag this increased heart rate as a sign of lying, when in fact it is simply natural psychological reaction to stress. False positive. As a result, a nervous suspect could be wrongly classified as deceptive due to their psychological response being misinterpreted. This is known as a false positive, where the test indicates a person is lying when they are actually telling the truth. In summary, the polygraph test is not perfect, and its accuracy can be compromised when the person is nervous, leading to a misinterpretation of psychological data. While polygraph can sometimes identify deception, they can also produce false results due to individual variation in a people's response to stress. Case 2. An overconfident examiner misinterprets psychological response. Overconfidence leading to calmness. An overconfident individual may feel extremely relaxed and unbothered during the test, assuming they can easily pass it. This might cause their psychological response, such as high rate or respiration, to remain unusually calm or stable. Even if they are being deceptive, the polygraph may interpret the calmness as sign of truthfulness even though the person may be lying. Misinterpretation of low stress response. In general, when someone is lying, they may experience increased stress, causing an elevation in their psychological response. However, a person who is overconfident may not feel the usual stress and anxiety associated with lying, leading to little to no change in their psychological indicators. In such case, the examiner may interpret the lack of psychological change as indicate that the person is truthful when in reality they could be lying. False negative. The overconfident subject may falsely appear truthful because their psychological response do not show the typical sign of deception, like increased rate or sweating. This is known as a false negative, where the polygraph incorrectly concludes that the person is telling truth while they are actually lying. Examiner bias. If the examiner perceives the subject calmness as a sign of confidence or truthfulness, they may inadvertently place more trust in the test result, especially if they believe the subject is not stressed. This could lead to the examiner not questioned by the psychological data, truly assuming the subject is relaxed because they are telling the truth. In summary, with the subject is overconfident, their lack of stress or anxiety may distort the expectation psychological response that the polygraph relays on the detect deception. This result is a misinterpretation of the data, leading inaccurate conclusion about the truthfulness of the subject answer. The polygraph in such cases may fail to detect deception and produce a false negative indicating the subject is truthful when they may be actually lying.
Case 3. A noisy testing environment causes inaccurate readings. In a polygraph test, accuracy can be compromised if there is a noisy testing environment that interferes with the psychological measurements being recorded. Polygraph measures psychological responses such as heart rate, blood pressure, respiration, and sweat gland activity. These responses are thought to change when a person experiences stress, anxiety, or deception. If the testing environment is noisy, several factors can lead to inaccurate readings. Distraction, loud sounds, conversation, or environmental noise can distract the person being tested or the examiner. This distraction can cause the person to become more anxious, which in turn could affect the psychological measurements, creating false positives for stress or anxiety. Signal interference. Noise in the environment might interfere with the polygraph machine sensor, causing inaccuracies in the data. For example, if the equipment is picking up electrical noise from nearby machinery, the readings for heart rate, respiration, or sweat gland activity might be distorted, leading to incorrect conclusion. Increase anxiety or stress. A noisy or chaotic environment could make the person being tested feel more uncomfortable or stressed. This heightened anxiety may cause o siguro sa kwan sa
Okay.
physical responses that are unrelated to deception, thus complicating the interpretation of the test result. Lack of control. Polygraph tests require a controlled environment to ensure that the psychological responses being measured are due to the specific questions being asked rather than external factors. A noisy environment undermines this control and could lead to inaccurate readings that don't reflect the subject true psychological state related to deception. In short, noise or distraction can introduce factors that make it difficult to distinguish between anxiety caused by deception and anxiety caused by the testing environment itself, ultimately reducing the test reliability.
Case 4. A person with medical conditions, example, high blood pressures, undergoes a polygraph test. Polygraph tests, often referred to as lie detector tests, measure psychological responses such as heart rate, blood pressure, respiration, and skin conductivity. These responses are believed to change when a person experiences stress, which could be due to deceit, nervousness, or anxiety. However, certain medical conditions can affect these physiological responses, potentially compromising the accuracy of the test. Here's how. High blood pressure, hypertension. Individuals with high blood pressure might already have elevated readings on the polygraph, regardless of whether they are being truthful or deceptive. This means the test may not accurately distinguish between normal physiological responses and those triggered by stress or deception. Anxiety or nervousness about taking the polygraph could further increase blood pressure, leading to falsely high readings. Heart conditions. Those with heart conditions may experience abnormal heart rate fluctuations that aren't related to the stress or emotional responses associated with deception. This could lead to an inaccurate result as the polygraph might mistake a heart-related response for a sign of dishonesty. Respiratory conditions. Individuals with respiratory conditions such as asthma or chronic obstructive pulmonary disease could have irregular breathing patterns, which could interfere with a polygraph's measurement of respiration rate. These irregularities might be misinterpreted as signs of deception, even though they are medically related. Anxiety and stress disorders. People with anxiety disorders or PTSD might experience heightened physiological responses like increased heart rate, sweating, or high blood pressure even when they are telling the truth. This could lead to inaccurate conclusions during the test, as a person's physical responses would be misinterpreted as signs of stress related to dishonesty. Medications. Certain medications, especially those used to treat conditions like hypertension, anxiety, or depression, may affect physiological responses. For example, medications that lower blood pressure or calm and nervous system could reduce the body's stress responses, potentially masking signs of deception. Due to these factors, polygraph tests are often considered unreliable in individuals with certain medical conditions. This is why the accuracy of the test can be compromised and results may be skewed if the person has health issues that affect their physiological responses.
Case number 5. A deceptive but well-trained individual manipulates their psychological responses. Polygraph test, commonly known as a lie detector test, measures psychological responses like heart rate, blood pressure, respiratory rate, and skin conductivity while a person is asked a series of questions. The theory is that the deceptive responses will provoke psychological changes due to stress or anxiety, which can be detected by the polygraph. The accuracy of the polygraph test can be compromised if the individual being tested is able to manipulate their psychological responses. A well-trained individual might control or suppress their psychological reactions through various techniques. Controlled breathing. A person can regulate their breathing patterns to reduce the variability in their heart rate and respirations, which is common indicator of stress. Mental relaxations techniques. Through techniques like meditations, training individuals can consciously control heart rate and skin conductivity. Physical techniques. Some individuals, techniques like meditations or techniques such as tensing in specific muscles or focusing on pain to shift their body stress responses. Logical recommendations. Incorporating multiple testing methods, polygraph tests should not be relied on as the sole measure of truthfulness. Combining polygraph results with other techniques like cognitive interviews or corroborative evidence can improve the overall reliability of the test. Use of control questions. To increase the reliability of the test, polygraph examiners should incorporate control questions. These questions, which are unrelated to subjects of the test, serve as a baseline for the individual's psychological responses and can help highlight and discrepancies that may be indicative of deceptions. The polygraph examiner's skills and experience are crucial for the test reliability. A trained examiner can more accurately interpret psychological responses even when the individual tries to manipulate the results. Improve more technology, advanced technology such as functional magnetic resonance imaging or brainwave monitoring may provide additional insight into a person's mental state. Not yet in replacement for polygraph tests, these technologies could complement traditional methods and help detect decisions more accurately. Pre-test preparations and monitoring instead of just relying on single test and individual baseline psychological responses should be monitored over an extended period. These longer observations could provide a more accurate profile of their normal psychological patterns and help detective unusual patterns. Addressing the legal and ethical concerns, the use of polygraph in legal or high-stakes settings should be done with caution, as individuals trained to defeat polygraph tests could the results ethical considerations including transparency about the limitations of the test and the potential for manipulations must be addressed. By the following these recommendations, the polygraph test accuracy may be improved, but it's important to recognize its limitations, especially when used alone to detect deceptions.
Polygraph accuracy can be affected by various factors, and addressing these factors can improve the reliability of results. Here are some factors and potential solutions to enhance polygraph reliability. So first is the physiological variability issue. Individuals have different physiological responses to stress, anxiety, or fear. Factors like age, health conditions, medications, and physical fitness can affect the accuracy of the readings. So the solution is use baseline measurements specific to the individual. Consider medical assessments and adjust polygraph parameters to account for individual differences. Conduct thorough pre-test screenings. And second is the emotional and psychological factors. The issue is the emotional responses such as anxiety, nervousness, or fear can distort physiological readings, leading to false positives or negatives. Solution: conduct a comprehensive interview to assess emotional state. Prepare the individual for the polygraph test to reduce nervousness. Implement relaxed environment to minimize stress before and during the test. And third, skill of the polygraph examiner. The issue: the examiner's experience and training. A significant role in the accuracy of the polygraph results. Inexperienced examiners may misinterpret the data. So the solution: ensure polygraph examiners undergo rigorous training and certification. Regular assessments and supervision of examiners can help maintain consistency in interpreting results. Number 4, question design. Issue: poorly formulated or ambiguous questions can lead to unreliable results as they may cause confusion or elicit irrelevant physiological responses. And solution: develop clear, precise, and relevant questions that are tailored to the purpose of the test. Avoid compound or misleading questions, ensuring they are easily understood by the subject. And fifth, the test conditions. The issue: external factors such as noise, temperature, or the presence of others can influence the subject's response, potentially affecting physiological readings. Solution: conduct the test in controlled, quiet, and comfortable environment to reduce distractions. Ensure privacy and limit the number of people present during the test. And 6, use countermeasures. Issue: subjects may employ countermeasures to try to manipulate the results, leading to false readings. Solution: increase awareness of countermeasures through pre-test, interviews, and monitoring during the test. Use advanced detection techniques to identify attempts at countermeasures, such as monitoring for physiological anomalies not related to the questions. And 7, Subjects' cognitive biases or deception. Issue. Some individuals may be skilled at deceiving the polygraph by controlling their emotional responses, making it difficult for the test to detect truthfulness or deceit accurately. Solution. Combine polygraph results with other investigative techniques or data sources to increase reliability. Use the polygraph as one part of a comprehensive assessment rather than relying solely on it. And 8. Technological limitations. Issue. The accuracy of polygraph machines themselves can be influenced by calibration errors, outdated technology, or malfunctions in the equipment. Solution. Ensure regularity, calibration, and maintenance of polygraph machines. Use the most up-to-date technology and software to ensure accurate readings and data collection. And 9. Test timing. Issue. The timing of when questions are asked in relation to physiological changes. The emotional reaction to a question can affect the results. Solution. Standardize the timing and procedure of questioning, ensuring the physiological responses are accurately recorded at the correct time relative to each question. And 10. Cultural and social factors. Issue. Cultural differences may affect how people respond to the polygraph or the types of physiological responses they exhibit under stress. Solution. Take into account control, differences in stress response and behavior, and train examiners to be sensitive to these variations. Consider cultural and social context when interpreting results. Conclusions. Improving polygraph accuracy involves addressing physiological, psychological, and procedural factors that can distort results. Solutions include better examiner training, refined question techniques, optimized testing environments, and combining polygraph results with other investigative tools to improve reliability and reduce errors. That's all. Thank you.